I'm using this platform to be able to discuss things regarding the heart, health, and prevention. And why is prevention important? Basically, because it's a lot cheaper and it's a lot better, with better outcomes than treatment. So, what does that mean exactly? So, if someone is having a heart attack, the best way to treat it is for them to never have a heart attack in the first place. And the best way for you to be able to prevent a heart attack is to understand what the risk factors for heart disease and heart attacks are: high blood pressure or hypertension, high cholesterol, diabetes mellitus, a strong family history, insulin resistance, smoking, and just not following up and taking care of yourself. A lot of times people have been blaming the pandemic because of some of their symptoms, some of their inactivity during that time period when in reality they may be having heart disease. And you will not know until you get worked up for it. One of the reasons behind that is some people remain asymptomatic. They don't have any symptoms of heart disease until it becomes the worst that it potentially can. And that can be a heart attack. That can be heart failure. That can be a stroke. That can be kidney failure. So it's important to follow up on a regular basis to make sure that if you do have those risk factors are being treated appropriately, so that you can prevent a heart attack from happening. Um, and a lot of people think that they're too young to have heart disease or they're too young to have a heart attack. I've seen people as young as 20, 22 years old as the youngest. But I no, I think I've seen someone in their late teens, 18 or 19 years old when they had their first heart attack. And the biggest reason behind it is they had a really strong family history of heart disease. Their mother had a heart attack in their early 20s. So they had significantly elevated cholesterol that we ended up finding out that led to their heart attack. So asking those appropriate questions is going to lead to it, but also seeking further information regarding um, whether you have a risk factor for heart disease. So that once again, high blood pressure, diabetes, high cholesterol, insulin resistance, strong family history, and smoking are common things that can lead to a heart attack, that can lead to heart disease. So when someone is having heart disease such as a heart attack, what are the typical symptoms that they complain of that gets me nervous? So this includes chest pain that is here in the mid-sternal region, sometimes can travel to the shoulder, sometimes to the jaw. Pain that is worse with exerting yourself, pain that is worse with stress, pain that is worse with pain that is better with rest or medication called nitroglycerin. So if someone has all of those symptoms, then I want to work them up to make sure that they're not going to have a heart attack now or in the near future. And the best way, the gold standard, is by doing a heart catheterization. It's an invasive procedure that looks at the heart arteries to make sure that there's no blockage. So what it does is basically looks at all the arteries around the heart, the major arteries around the heart, to make sure that none of those arteries are affected. That can be potentially leading to a heart attack in the future. It typically takes anywhere from um, 30 minutes upwards to an hour, just depending on the complexity of the anatomy. And if there is a blockage, if there is a significant blockage, one of the ways that we can help out is by putting in a stent. The caveat is that if people have several blockages or blockages in scary locations, then we may have to forego the stent and discuss potentially about bypass surgery, coronary artery bypass surgery, or coronary artery bypass graft or cabbage. So, this whole story about heart disease and what we can do starts with just knowing what the risk factors are. Pepper says, "Hello, how are you doing? I hope you are doing well." Um, so what else can we do? With prevention, it's understanding that the things that you don't do can lead to heart disease. If you're not active, that can lead to heart disease. We typically want people to exercise 150 minutes every single week. moderate intensity activities. So if you can't do that, I more care and want you to be consistent with your exercising. If you can only allot 10 to 15 minutes, then do that. Be consistent while watching what you're eating, and watch your body change over time. Typically, in my mind, I always say that it takes about 1 month for you to start to see those changes. It takes an additional month for your close family members and friends to see those changes, and then a third month for people who don't see you very often to see those changes. So just keep getting after it, understanding that you may not succeed now, you may not succeed. I've had multiple falls, and I keep getting back up. I had the I'm not I had the, what is it called, the pandemic 15. So working my way to getting back down, but understanding that I need to do this now because it only gets harder and harder and harder. And going off topic to weight gain, it can lead to things like sleep apnea, which can lead to things like atrial fibrillation or even heart failure. So knowing what your weight is now and doing whatever you can to bring it down as much as possible. If you guys have any questions, ask the questions and I'll try my best to answer it. I'm gonna give about a minute for people to ask questions, so that I can potentially answer. Any questions? Just shoot the questions. Pepper, if you're still here, ask a question. I'll try my best to answer it. All right, I'm gonna give it like 20 more seconds and then start going on the next topic in regards to prevention. Do you believe in the existence of God? Off topic, but also not off topic because I do, I am a Christian. So the answer to that is yes. But, here to answer questions regarding the heart health and prevention, but I'll take any questions as much as possible. Um, I guess to help with that question, so, one of the things that is very difficult that I find myself asking is, as I have enhanced in my career in medicine, I have found that it has been difficult um, with my faith, and I can understand that other people are going through the same. But reminding myself why I became a doctor helps with that. Having close family members and friends who pray for me, who want the best for me, has helped significantly. Miniature expeditions, thank you for the question. All right, so we're gonna get back to the next topic when it comes to prevention. This is hypertension or high blood pressure. What is high blood pressure? That's when the systolic number, the top number is 120 or greater. That is the bottom number is greater than 80. We want it to be around 120 over 80. If it starts to become above that, it puts you at risk of having issues with that: stroke, heart attack, heart failure, dementia, kidney failure. So always important to know what your blood pressure is and know that we can potentially treat this naturally without any medications initially. That includes things like exercising 150 minutes, like I said, watching what you are eating, the DASH diet, dietary approach to stop hypertension, getting regular checkups because your high blood pressure can be secondary to something else, something like sleep apnea, renal artery stenosis, fibromuscular dysplasia, issues with your adrenal glands, issues with hormones. So following up with your primary consistently to make sure that that's being checked appropriately, to make sure something else isn't causing your blood pressure to be elevated. Also understand that stress is a huge component of it. Stress is probably the most understudied or underappreciated component when it comes to your overall health. That significant stress can lead to high blood pressure. um, Not getting enough sleep, also not having any ways of relaxing or coping whatever stressors is in your life. Electrolyte issues such as potassium and magnesium, if those are out of whack, can lead to high blood pressure. Food, once again, processed food can lead to high blood pressure. So it's always important to make sure that you're getting your exercise, watching what you're eating, watching your stress, because it can lead to poorly controlled hypertension. And in some cases, when you're not able to get that blood pressure down, despite the dietary restrictions that you've given to yourself, or the appropriate foods that you're eating, the exercising and everything, then you may need to be on some medications for it. And we typically want to choose the right medication that is for you, and try to avoid as much reactions to the medications as possible. Give it one more, 30 seconds to be able to answer any questions that you guys may have, and then I'll give a short 1 to 2 minute closure and summary, and try it again tomorrow. All right, Dr. Isang here. Pretty good turnout for the 10 minutes of asking, talking about heart health and prevention, and asking and trying to answer any questions anybody may have. If you do have a question, you can always reach me on all the medias with the same handle. But just understanding that heart disease, when it comes to heart disease, when it comes to your health overall, it's a lot better to prevent it from happening. Understanding what the risk factors are, such as high blood pressure, understanding to follow up with your primary medical provider at least once a year, but you may need more visits throughout the year if there's active issues. But knowledge is the biggest thing that can help when it comes to your heart, when it comes to your health, and when it comes to preventing the horrible consequences of heart disease, strokes, kidney disease, strokes, heart attacks, dementia, the financial burden of it. And that's it. I'll talk to you guys later.